Hello, my name is Shirley. I'm one of the clinical team members at Chartwell Hospital. I'm going to explain what happens when you come to Chartwell Hospital for your gastroscopy procedure. You'll come through into reception and one of our friendly receptionists will hand you a form for you to fill in. Once you've filled that form in, she'll call a member of our clinical team and they will come down and they will escort you up to our admission room. We have stairs or we have a lift for those requiring the lift. Once you've been admitted and we've gone through everything with you, we've explained the procedure, the doctor will come in and he will have a brief chat with you and it's your chance to ask him any questions if you've got any concerns. When you're happy, he'll ask you to sign the consent form that you agree to him to do the procedure. Once we've done that, we will take you through into the procedure room and we'll introduce you to the team in there. We'll sit you on the bed and they'll ask you a few questions. When everyone is happy, we'll lay you down onto your left side. We'll put a small mouth guard into your mouth and then the doctor will begin the procedure. Because you're laying on your side with your mouth open, with the mouth guard in, sometimes you get some saliva collecting in the corner of your mouth. There'll be someone standing behind you, they'll be reassuring you, and they may have a little suction catheter just to clear your mouth if there is saliva there. A gastroscopy is where the doctor passes a fibre optic camera into your mouth, over the back of your throat and down into your esophagus, which is your food pipe. Your stomach needs to be empty for the doctor to be able to complete the test properly. So we ask that you have no food for 6 hours before the procedure and only clear fluids up to 2 hours before the procedure. All of this information will be sent to you in the paperwork through the post. There are two main concerns that people have when they're having a gastroscopy procedure. The first one is that they're concerned that they'll be sick. As long as you've followed our fasting instructions in the information we would have sent you in the post, your stomach should be empty, so you should have no concerns there. The second worry is that people are worried about gagging. Gagging is a natural reflex and it's nothing to be alarmed about. He'll look down the whole length of your esophagus and go into your stomach. He'll look around your stomach and go through the exit into your duodenum, which is your small intestine. He'll come back with the camera and he may feel it's required to take some biopsies. A biopsy is just a small sample of tissue and you won't feel any discomfort during that time. He does put lots of air in and you may feel quite bloated and that's perfectly normal. He will then come back out with the camera and the whole procedure takes between 3 and 7 minutes. You'll then be escorted through to the recovery room and a member of the team there will go through your paperwork with you. The doctor will do a report, which we fax to your doctor, but we will also give you a copy of that report when we go through your discharge paperwork. For your gastroscopy, we can offer you two options. We can offer you throat spray and sedation, and I'll explain both of those to you. Throat spray is where the doctor sprays the back of your throat with a local anaesthetic spray. He'll spray it and almost immediately you'll start to feel a numbing. This will last for 30 minutes. Some people are concerned that once it's been sprayed, it will have an effect on your being able to swallow properly. It doesn't. You will always be able to swallow properly and it doesn't affect your breathing. After 30 minutes, you may have a sip of water. If you feel the numbness has gone and you can swallow properly, then you can eat and drink as normal with no restrictions. When you have sedation, the doctor will put a small cannula in the back of your hand or in your arm. This will enable him to give you the sedative which will relax you throughout the procedure. Once the doctor has placed the cannula in the back of your hand or your arm and he has given you the sedative, it works almost immediately. It will relax you, but you will always have full control of your actions at all times. Because we're giving you sedation, we do have to give you oxygen, and that will be through a little nasal cannula that will sit in your nose. We'll also put a small probe on your finger to monitor your oxygen levels and your pulse. When we give you sedation, it does mean there are some restrictions on you afterwards. You'll be unable to drive for 24 hours. You'll be unable to have any alcohol on that day. And you will have to have somebody with you for at least 12 hours because sometimes the sedation can make you a little unsteady or a little lightheaded. You'll be given discharge information to go home with. You should read this thoroughly and it will explain everything in full to you. If you have any questions or concerns, please feel free to call us on 01702 478 885. You will also find this number on any paperwork we have sent you and in the link below.